The wellness influencers talk about the evils of big pharma and the magic of home remedies for rheumatoid arthritis every single day. But here's what the wellness influencers will not tell you. None of this is new. Humanity has tried every single one of those remedies over centuries, and over all that time, rheumatoid arthritis kept destroying joints. Let's take a walk through history. 3,000 years ago, the Egyptians were soaking in mineral baths to treat swollen joints. In 400 BC, Hippocrates prescribed therapeutic bathing for arthritis. The Romans built thermal baths for rheumatic disease. But when a Cochrane review put spa therapy to the test, the evidence was weak and the study quality was low. In India, Ayurvedic practitioners were grinding turmeric into a paste and rubbing it onto inflamed joints 2,000 years ago. Now, multiple meta-analyses have shown that curcumin can help with joint pain and swelling and can potentially improve markers of inflammation on blood tests. However, the certainty of the evidence was very low, and there were limitations to the studies, including the sample sizes and the fact that curcumin was added on top of conventional therapy and not used instead of conventional therapy. Bee venom, that's not a TikTok discovery. Apitherapy, the practice of deliberately stinging yourself with bee venom, was already started many years ago when people noticed that beekeepers had less arthritis. A 2014 systematic review on bee venom acupuncture found only one study that met inclusion criteria, and the quality of the evidence was very low. Copper bracelets, the idea that copper absorbed through the skin can fight inflammation. They did a study on this in 2013 and found that copper bracelets were no better than placebo. That means they had no meaningful therapeutic effect whatsoever. Essential oils. Lavender, rosemary, chamomile, these have been used for generations. A systematic review found that topical essential oils can briefly reduce pain intensity, but a brief reduction in pain intensity is not modification of disease progression. Elimination diets. Gluten-free, dairy-free, nightshade-free. No elimination diet has been shown to modify disease activity in rheumatoid arthritis. The only dietary pattern that the American College of Rheumatology recommends is the Mediterranean diet, and that is for modest modification of pain and does not alter disease activity. So after 3,000 years of bee stings, essential oils, therapeutic bathing, etc., what finally worked? It was disease-modifying anti-rheumatic drugs. These drugs target specific immune pathways in rheumatoid arthritis. They preserve function, they prevent joint destruction, and they give people their lives back. And this is supported by multiple large-scale trials. Can a Mediterranean diet, fish oil, yoga, turmeric help with pain control? Yes, absolutely. In addition to the medications that are recommended by a rheumatologist, not instead of. When a wellness influencer tells you to throw away your methotrexate and drink turmeric lattes instead, they are telling you to go back centuries to a place we have already been and that has been proven ineffective. In the words of Miss Kamala Harris,
America, we are not going back.
If you have RA, please listen to your rheumatologist.